to add to that pressure that is on our NHS services, particularly at this time of year. It is traditionally the busiest time for our doctors, hospitals and health workers. And today, BBC Radio Cumbria's John Bunness is at one of the county's health centres to find out how the NHS is preparing. So remind us where you are, John.
Yeah, good morning again, Steph. Well, I've come along to Carlisle Healthcare Centre. It's on Locke Road. It's off Eastern Way in Harrowby. It's one of 3 sites that it has in the city. They have 186 members of staff caring for more than 40,000 patients. Now, that's over half of the population in Carlisle. So I've been here today seeing a little bit of what goes on, and it's maybe not the bustling place you might expect for a site that's looking after so many people. It's all very calm. There's a big, extensive, big, wide sort of reception area when you come in. Plenty of space to sit down in comfort and, wait to be called to go into your appointment after you've registered. So it's sort of a tranquil, calm sort of site, really, if you do need to come to see your doctor or one of the other healthcare people here. And I've been talking a bit about winter pressures on the NHS and also what it's like for people to get appointments these days. Here's what one of the patients has been telling me this morning with winter on the way. He's called Neil. He's from Carlisle. He told me what it's like getting an appointment here. And because he's on continuing treatment, he says that's working well.
For myself personally, because I've had a heart attack, if my wife phones up and unfortunately they say no appointments, as soon as she mentions my name, it's obviously on the site that it alerts them straight away that I do need to be seen, and I personally have never had a problem. My normal course of treatment up here is for my bloods to be checked because I'm on warfarin. I see the nurse normally once a week. If my bloods are okay, it can be 2 or 3 weeks till my next appointment. If my bloods aren't right, then it's the following week, and she makes the appointment there and then. So I personally don't have problems with appointments up here.
A health centre like this is very big compared with many other surgeries. How do you find that different as a patient?
Because we've been with this service for years, we've been to Stanwix before, which is very good. The one in town is very good, but apart from the lack of parking. So me personally with this surgery, these doctors never had a problem. But I've been with these all my life, so I have no experience of any other surgeries.
If you've been with it all your life, you're clearly a satisfied customer.
Oh, yes. Yeah, never had a problem here.
There we go. So that was Neil there. And John's still with us. John, just how busy has it been there so far today then?
Well, I think getting increasingly busy, Steph, in terms of patients contacting the place wanting either appointments or advice. Earlier on, there was something like 100, I think when we first spoke to one of the senior doctors at somewhere between 8 and 9, and there was something like there'd been about 130, I think it was, calls and similar numbers of contacts online, which is the other way to get in touch. Up to 12 noon, the latest figures for you are they've had 194 telephone calls from patients and 245 online contacts. So that's interesting. That's, notably more people getting in touch online, making a total of 439. And that's sort of patient contacts seeking advice, seeking possibly appointments in many cases. And that adds, of course, to all of the earlier appointments that were already booked for today. So those are the new customers getting in touch this morning.
Yep, thank you very much, John. And of course, as John pointed out there, that is just at one GP practice as well. We'll be catching up with John a little bit later on once again.